So blood thinners during pregnancy is not something that everyone always dreams of having to do. So I'm making this video today to encourage those of us who have to take blood thinners while pregnant, especially injections. That can be scary, and I hope this video finds you well. Hey, Staying Kingdom Minded, thanks so much for coming back for another video on our channel. So today I want to talk to you about blood thinners during pregnancy, and this is something that I have to do because I had blood clots in my lungs from taking birth control pills a couple of years ago. So they said since my blood clots were from increased amounts of hormones from the birth control pills, that anytime I have increased amounts of hormones in my body, like when I'm pregnant, I will have to take blood thinners to prevent blood clots. So I'm going to show you the supplies that you need to be able to do your injections. So some people are on Lovenox, some people are on Heparin. The difference is the half-life of the medication is shorter in Heparin, so you might have to take more of the medication or inject it more frequently. Lovenox lasts longer in the system, so you may only have to do once a day injections or lower doses of the medication. So that's kind of like the big difference. And then there's a cost difference as well with my particular insurance. I believe probably with all insurance, Lovenox is more expensive and Heparin is much more affordable. So we are doing Heparin. This is the vial that I'm using. So you have your Heparin vial. I have used a couple of others as well. As the pregnancy progresses, the more amount of blood volume that you have flowing through your body, you may have to change, the doctor may have to change or increase your dose. So at different times I've used a couple of different doses of the Heparin, but so it's still the same medication. I have these kind of needles. These are insulin needles, and I prefer those when doing these injections just because the needle is so much smaller and it hurts less, which is a good thing when you gotta poke yourself with needles every day. And then just some basic alcohol prep pads. So obviously I've got mine from CVS Pharmacy. I was using different needles in the beginning, which were 1 milliliter TB syringes is what my doctor's office had originally prescribed. And that needle is a little bit thicker. I think it's about the same length, but it was a little thicker, and so it didn't feel very nice. So the insulin needles are much better for me. So whatever works for you. I am currently having to do 2 injections because it's 1.5 milliliters of this particular dose of heparin that I'm using. So I have to do 2 injections in the morning and then 2 at night. So I'm just going to show you how to draw it up. So you pull back your syringe. We're gonna do 1 milliliter. So you pull back the syringe, and this is a brand new stopper, a brand new vial. So you inject the air, and then you pull back on the needle and fill up your syringe with your medicine. You gotta kind of play with it a little bit to get air bubbles out. You don't want to inject air bubbles. So once you get it, you can kind of flick it with another syringe or with a pin or whatever you need to do, up and down a little bit until you get the needle filled with medication. And then you do the same thing with the next one. So that one was 1, so this one's going to be my half. So inject the air and then pull back the medication. And then it's called a subcutaneous or a sub-Q injection is what it is. So it doesn't go into your muscle layer, it just goes not as deep. So there are multiple different sites that you can use to inject for subcutaneous. So on your abdomen you have subcutaneous tissue, on the back of your arms, on the tops of your thighs. I will insert a picture of different subcutaneous injection sites that you can use to inject. I typically use my belly, which seems a little bit bizarre being pregnant, and some people could be kind of freaked out about having to do shots in their belly while there's a baby in there. You're not coming anywhere near your baby with these shots, so you don't have to worry about that. You're just going in that, you know, that adipose tissue, that fat layer right at the top of the skin. You're not going in very deep, so it's not going to negatively impact the baby, so you don't have to worry about that. And let me see if I can show you guys how to actually do the injection. So let's try. Okay, so first things first, you open up your alcohol, and just for modesty's sake, I'm just going to show you just a little bit of my belly that I'm going to use. So your belly button is here, and you're supposed to go at least 2 inches away from your belly button, and I go lower on my belly. So you just clean with the alcohol, and got your needle. And for me, it just works better if I kind of bend down a little bit when I go to do the shot, so it doesn't hurt as bad. And you just hold your skin and push in the needle, and then just inject the medication. And honestly, I don't feel it going in. It doesn't hurt, it doesn't burn, it doesn't sting. It's not scary, it's not painful. Honestly, it's truly no big deal whatsoever. So that is all that there is, and I typically don't bleed at all from there. And I alternate sides, so I did the 1 milliliter over there, so then I will inject the 1/2 of a milliliter on this side. So as you can see, it's really simple, it's not very painful, and like I said, heparin is much cheaper for me than Lovenox is, so that's why I'm using that particular blood thinner. There's no labs that have to be drawn to check, like, you know, when you're on Coumadin, the by mouth medication, you have to have PTINRs drawn. There is nothing like that that you have to have drawn for heparin. Say you are on the medication and you have to end up having to have an emergency C-section, the half-life of the medication is so short that you know, they don't have to really worry about it so much with heparin, but there is reversal agents that can be used. And so honestly, it's really just as simple as that. So if you guys have any questions about blood thinners while pregnant, if you have any questions about heparin specifically, or how to give the shots, or anything I didn't explain clearly, any other questions that you have, please feel free to leave those in the comment section below, and I would love to try to help you. Thank you guys so much. I pray this video blesses you. I hope that it encourages you. And if you're just new to starting blood thinners while pregnant, I hope that it just helps you to not be fearful and to cast all your anxiety and cares upon the Lord, and let Him help you through each and every stage of your pregnancy, each and every stage of your journey of life. So, and don't forget, remember, wherever you are and in all things, stay kingdom minded. I'll see you guys in the next video.